Uh, Good afternoon, ma'am.
Good afternoon, Tarini.
So today we have with us Miss Sri Ranjini Tyagarajan, and this is part of D.O.R.A.I Foundation's Health Initiative, Health Fest Initiative. D.O.R.A.I Foundation has been doing this for the past 3 to 4 years, and it is an initiative as in more of an awareness program. And in this particular month of May, the interns at the D.O.R.A.I Foundation, we have been interviewing people with different kinds of physical illnesses, disorders, and disabilities. And we present it to resource people like you who could then share their insight and thus ensure that there is a little bit awareness among the viewers of this video and the whole Health Fest initiative. And the D.O.R.A.I Foundation was actually founded by KVG Dr. Sumitra Prasad. And there's a lot I could tell about her. But then, yeah. And the foundation is actually known for its social work. And one unique aspect of it is it does not limit its resources to one particular sector of the society. And it does everything it can and you know, puts it forward to the whole population. So that is about the referendum. And today's topic at hand that I would like to discuss with you is parenting children with febrile seizures. And as we know, febrile seizures are they cannot be categorized as epileptic seizures or general seizures as such. They last only up to the age of 6 years. So, Mom, go on and enlighten us about the topic.
Sure. First of all, thank you, Tarini, for giving me the opportunity to share what I have also learned or what I'm still exploring in the world of humans. And a big heartfelt thanks to the D.O.R.A.I Foundation and Dr. Mrs. Sumitra for all the good job that she's been doing, and she's trying to extend through students like you to reach the mass. So as such, today it's so important to have an understanding of the mental health, because it's not just about being sick or just walking to a doctor and consuming pills and walking out, but it has a lot more to do when it comes to recovery. So I'm really very grateful to Mrs. Sumitra on this aspect, and thank you for giving this opportunity before I start.
Yes.
Yeah. To tell you about seizures, basically, seizures are just it is a burst of all uncontrolled electrical activities that go on in the brain cells, okay? And this can cause temporary abnormalities, basically in the muscle tone or movements or body, body movements or behavior or sensations or even the state of awareness of a patient. Okay, so now when you categorize seizures, like we have two major groups. One can go on to what we call the focal onset seizures, and the other one is the generalized seizures. Okay, so the difference is focal onset seizures, they start from one point or one area of the brain and they gradually spread across to other areas. And with the generalized seizures, it starts on both the sides. They start parallelly on both the sides, and they it just starts spreading across. Now under the generalized, we have tonic seizures where your muscles become stiff, okay, and then you have atonic seizures where your muscles are relaxed. Myoclonic, where you have short jerkings in part of a body, or you have clonic seizures as well, where there are periods of jerking in the body. Okay, so now typically a febrile seizure is supposed to be a benign one, not very harmful in nature, and is usually found in very younger children, probably ranging between 6 months to 6 years. Okay, so they are more of provoked seizures because febrile seizures happen when there is usually an infection. So it's the body's response to some kind of an infection that goes on within the body. And the seizures are, as you said, very short-lived. They do not last for too long. Very rarely, up to 15 minutes, they can go on. And these are usually harmless, as I said, and they do not create any kind of mental abnormalities like any other seizures would do. This can be detected as early as 6 months to 3 years in very little children. And febrile seizures need not always be recurrent, but sometimes they do come back as well. So this could depend on a couple of factors, and one could also be a hereditary factor, meaning to say, if one of the parent is used to, or one of the parent was into getting these kind of seizures when they were very young, there is a probability that the child could also be carrying one of these aspects. So this is about febrile seizures.
Yes, thank you very much for explaining and giving us so many categorizations. In this particular case, which I have interviewed, the child has had 4 episodes with a span of 6 years. The child has had 4 episodes of febrile seizures. And I recall the mother telling me during the interview that the first time the child had a febrile seizure, or she doesn't know what exactly a febrile seizure is, or maybe a seizure for that matter. All she knows is the child is fidgeting and he's having an attack. And I recall her telling me that she was carrying the child in her arms and running around for help. So that is a kind of reaction any mother would, put forward in such a situation. And because nobody is really aware of what febrile seizures are, or seizures are, and when do they occur, and because the onset is sudden, it doesn't like tell you and then come out. So what do you think would be the state of mind of a mother in such a situation? And if the mother is in fact um, very disturbed, obviously, because it's her own child. And what do you think the mother should be doing in that situation?
Tarini, actually, since you were saying that the child has already undergone 4 seizures. Okay, now every experience is a different experience for a mother. Okay, first one can be highly traumatic and highly shocking, because the mother is in a mode of denial first. That's the first reaction that can happen to a mother. Okay, there is always a zone of why my child, why me. Okay, so invariably the first reaction that comes is, no, this is not happening to my child. Or you don't know what is happening, you're just frozen. You're just seeing the child suffer in front of you, not really knowing what next. You're frozen, brain frozen. Okay, so at this point in time, it really doesn't matter to find out how many episodes the child has gone through, because every other episode, as I said, can give a different experience to the mother. And with probably some bit of learning in every episode. Maybe first one, they get to know, yes, my child has seizures, and in the next episode, mother is slightly under the thought process, okay, maybe this is a seizure, not sure yet. So as every time it progresses, there is some bit of framing that happens within the psychological aspects of the mother as well. Okay, so she's trying to prepare herself to see what is coming up with the child, because we really don't know how severe or what the child can get into during the seizure. And watching the child suffer in front of you is definitely a very traumatic thing for a mother. No, I mean, it doesn't matter even if it is the simplest of seizures. Seizure is a seizure. I mean, it makes a big impact on the mother. So there can be emotional outbursts, not knowing what to do. Mother can run helter skelter looking for help, not knowing. She may try to do whatever things that comes into her mind. Some, if she has the support of other people at home, maybe like, running around to get some water, these are the natural things which people tend to do, trying to sprinkle on the face, or because the first attempt we don't know it's a seizure. Okay, so mother only tries to figure out what is going wrong. Has the child picked something? Or like there is so much of trauma, so much of confusion and chaos in the mother's mind. She's clueless about what is happening and which is the way forward. So at this point in time, I would say it is a mode of denial and shock.
Yes, ma'am.
For the mother. Yeah.
Yes, ma'am. Now like that we are aware of, how the human behavior is in such situations, it would rather help the individual to understand how to identify a seizure, right? Because it cannot be it cannot happen in that particular state where you are able to categorize it as a febrile seizure, reason out. So the first thing that you see, how do you identify that it is actually a seizure and not some other kind of abnormality that is just happening out of nowhere? You need to see that and cater to it. How do you do that?
Okay, so let me tell you, usually febrile seizures follow a high fever, or it could be an indicative factor that the seizure comes first and then the fever. So it means to say that the child is probably into some kind of an infection, which to a layman's eye, we cannot track infections unless we see the child having a running nose or literally having high body temperature. So in such cases, it is pretty hard for a mother to think out of the box and understand whether it's a seizure or any other thing that's going on with the child, unless it is seriously showing up on the child's activities or behavior. Okay, so now when you're talking about febrile seizures, there are certain things which we can look for, like if the temperature goes really high at some point in time, if the child is developing a seizure, there could be jerks in some parts of the body, or the whole body could be jerking. That is one. The child could start frothing at some point. That could be one of the ways where you find out. There could be eyes rolling out. The child's eye may start rolling around, and at some point may even turn unconscious. So if we happen to see any of these, and in some cases also clenching the teeth, they are not able to do anything, and they're like uncontrollably moving. So when these kind of things happen, probably the mother, if it's the first experience, is still puzzled why the child is going through this, unless the mother is aware that these things happen when there is something called a convulsion that comes up. So they can look into these options, or to see if these symptoms come up in the child. And once they see this, they get to understand that this is something to do with the febrile seizure.
Yes, ma'am. Okay. Thank you for answering that question. Ma'am, in this particular case, the one that I have interviewed, the people I've interviewed, what actually happened is that the first time when the child had the febrile seizure, she did not know what to do. But the second time the child had, like before the time the child had the second seizure, the mother educated herself and increased her knowledge in the particular about the particular topic, and visited doctors, had a lot of consultations, and then her behavior, there was of course a change. And she also told me that due to the teeth clenching part in her son, damage could happen to the jaw and to the teeth because it is extremely strong. And she used to put her fingers inside in order to prevent that jar. But in turn, she used to be affected. So she told me that you were supposed to use this particular part of the hand to stop it, so that there's like a lot of flesh and you're in turn not injured. So there are certain things that she picked up. But watching the child repetitively going through something like that is not easy on any mother or human being for that matter. And she developed anxiety. She developed symptoms of OCD because she tried really, really hard to keep the child away from infections and from germs. She also picked up the habit of, becoming a germaphobe. And so, what is your take on that one? Like, it is. It is often that once we are exposed to certain kinds of things, we are not able to differentiate that this is happening because of that, and these behaviors are often seeped into other situations in life.
Right. Um, this anxiety is a very natural response to stress. Okay, so when you always have a sense of insecurity with a particular situation, not knowing how, what next, or what this child is going to go through, how many times am I going to go into this? There are a couple of questions which run through a mother's mind, which is quite natural to the situation. But at this point in time, I would say that acceptance is the first and a very vital, important point that all of us should keep in mind. Probably when you go through any kind of an eventuality, most of us are pushed into the mode of denial. So when you go into a mode of denial, you are not allowed to proceed into normal or logical reasoning. Okay, so you're stuck there and you're just waiting to think what next. You don't know, and your mind races like anything. You're not able to hold your mind because you are scared. Okay, so at this point in time, accepting the fact that yes, this child is going through this, the child has seizures and is capable of having febrile seizures every time he falls sick or whatever. Once that acceptance part comes into the head, okay, that means in all senses accepting every part of the disease as it is. Okay, that's when your mind tends to calm you down. Okay, you know now that your child is capable of getting this. So in a calm mindset, you're able to think further. You're able to prepare for any kind of such incidents that could occur. Okay, now when you're stressed out, all you can do is panic. Your body freezes. You start your heart starts throbbing faster, and you sweat. What not happens when you're anxious? Your mind goes to any extent, it just raises like anything. So the first thing would be is accept the fact that the child is having a problem or is having this seizure. Okay, and once you understand this, first take your own breath, control your breath, because once you're stressed, you also know that your breathing goes really fast. You don't know, maybe we don't notice how fast we breathe, but at that point in time, with the fast breathing also goes a faster mind. So you just need to take that few moments for yourself. Take a deep breath and just say it's all going to be fine. I mean, it is fine, because you need to place yourself in a safety zone, or understand that when your child has had a previous episode of seizure, you've been through this and you've seen your child come out of it and is safe as well. So you need to tell yourself or reiterate to your mind that my child is safe after this. Not will be safe, but is safe, because you know what are the next set of activities that will go on. The child will convulse, and maybe after a few minutes, like, the child may be probably semi-conscious or unconscious for a while, and then afterwards, if you are medicating the child, you give medications, else the child tries to recoup. Okay, so this thing keeps happening every time the seizure happens, but being prepared to see it will make your work much much lighter. I know it's a tough thing. It's not easy to see the child convulsing or go through this, but when you're prepared, or when you know that your child is getting into this hard phase, the mother prepares herself much ahead of the child. If she knows that the child is getting into this, there, that's an alarm for the mother. Okay, you be prepared with this. So when you know that you're getting hold of the situation, you may probably stop overthinking and just focus, because now that you're prepared, your mind is calm. When it is calm, it helps you think better, and when you think better, you're able to move ahead with your issues and not stagnate into anything. So with this, you will know breathing is a very important technique, which probably the mother can follow. um, I know it can be hard to do it when you're facing the situation, but it takes a lot for us to make ourselves, because unless we are strong, we cannot get into helping the child. So if I need to be a caregiver, I need to be mentally as well as physically strong myself, so that I can give what I can to my child. And any mother would want the best for her child. So keeping that in mind, once she understands that she's going to do the best for the child, she'll automatically step behind to understand that the child will be in a safer zone in a moment or two. Like, she needs to just prepare herself for it and understand what next. She needs to be alert and prepared for the next set of activities to help her child recover from the seizure.
Yes.
Okay. And when it comes to hurting herself, or trying to open the child's mouth so that there is a free airway or whatever, one opinion that I would like to just share. um, you probably need not do anything when the child is convulsing. Okay, there are certain things that could probably be followed, like if you don't obstruct the path of the airways, it is easier for them to breathe as well. So, like, do not, trying not to do anything with the person convulsing would help them settle. It's one thing that they can always do is keep them on the floor, or keep them in a place which is safe, with no objects around, or anything in the mouth that can actually choke the child or do anything of those kinds. And not feeding the child at that moment. I'm sure the mother must be aware of that. You don't usually feed a child who's convulsing, because there is the hazard of choking. And there are certain postures which they can try while the child is convulsing, or is, like, you can lay them on the floor and just ease out the buttons around the neck, so that the child's airways are like more patent. Okay. And you the hand that is closer to the caregiver can be crossed over the chest, with the hand on the cheek, with the palm, this part of the palm here on the cheek. Okay. And parallelly, you have your the furthest thigh, which you can gently lift and keep crossed, so that the thigh also touches the floor, and gradually roll the person over towards the side, so that, and then slightly lift their head and open the mouth, so that they get the airway free into their, you can help the patient breathe in a much better way. So these are small little things that we can do to help the convulsing person, but that totally depends upon the mindset of the person who's watching the person
Yes.
who's into convulsions. Yes.
Yes. Thank you for sharing that particular technique, Mama. I'm pretty sure
Yes.
that is actually very helpful. And moving on to the next question, from the mother's point of view again. Uh, in this particular case, and I'm sure this is something other mothers could also agree. If it is not just restricted to this case particularly, what actually happens is, once you see that the child is going through febrile seizures and is diagnosed with febrile seizures as such, what happens is there is a change in the parenting style, right? This particular mother in this particular case, she wanted to raise her child in a very in a very liberated environment where the child actually had choices. But he, once he showed the signs of febrile seizures, she had to prevent the child from so many things, so many pleasures that would, enhance or is, probably the essence of childhood, such as chocolates, such as going out, hanging out with friends, going to nursery school. All of these things were restricted for the child to do. He was not allowed to have chocolates because of the fear of, catching a cold, or the child was in nature very delicate apparently. And in such conditions, the mother had to take up more of an authoritarian kind of parenting style. And she always had this guilt that, her son could not enjoy all the pleasures of childhood, that is. And but she kept rationalizing herself that this is something she had to do in order for her child to have, to be a little healthy, and it is something that she had to do in that situation. How important is this rationalization for a mother who's having a child who faces febrile seizures?
Yeah. See, one thing is, when you look at it from a mother's perspective, mother always wants to keep her child safe. So there is always fear ahead when it comes. Okay. So invariably, if you ask me as well, even I, as a mother, I may have my own fears when I'm keeping my daughter next to something, or I may say, no, 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 this is not good for you. Don't eat this. Don't eat that. If you eat chocolates, this will happen. But from the child's perspective, I think it is important you give the child that experience. Okay, fears apart, there is always something called a balanced zone. Probably, you can figure out up to maybe having one chocolate once a while is not going to immediately affect the immune. Okay. And secondly, or I would put this as a priority, more than worrying about just the environment, somewhere we need to also believe in um, improvising our child's immune system. Okay. And immune system gets better as the child is exposed to more of germs. It might sound a little funny, but usually the more exposed you are with dirt, if you've seen little children, they love soiling their hands, they love playing with mud, filth, name it, whatever. And that's when even they catch infections to it's on a higher rate with smaller children, because they don't know what to put where, and they put their hands all over, it's in the mouth, into the tummy, and they're down with something. Okay, so this can be very traumatic for the mother, because as a caregiver, she has a big task to look forward to: a restless baby crying, or a lot of things. It can actually take the mother's mental peace to task. But I would say that, in the interest of the child, the mother is laying certain strict rules so that she doesn't have to see her child suffer, which probably gives her the solace that my child is safe if I'm behaving like this. Okay. If you're talking about rationalization, I would say, if you have gone into this mode to tell that I'm doing this for the benefit of my child, okay, then there should not be this factor called guilt, because you are doing it for the good of your child. You want the best for your child. So, if you think that I've snatched away my child's happiness by, taking away what a child can enjoy, there is something called alternating always. Okay. So if you're not able to give a chocolate, find something else, but you can, give it a shape of a, there are so many ways where, they can make good shapes of cookies made at home.
Yes.
Maybe homemade chocolates. Like, if you feel buying it from outside is a problem, you can always alternate to homemade stuff, giving it different shapes, different colors, safe colors, what you can use for the child.
Yes.
And there are a lot of things that can make it look more creative, more fun, and more enjoyable for a mother to feed the child, as well as get out of
For
the
the
guilt
child.
factor that my child what she wants, he or she wants. So, sometimes this authoritative mother parenting is um, maybe a benefit to the mother, because it will give her the solace, as I said, that she is safeguarding her child. Okay, so it should end there. It should not go beyond this. If
Yes.
this continues, an anxiety saying, no, I have done this, then there ends. Like, the
Yes.
worries can just mount
Cycle.
one above the other.
Yes.
So if it is for the benefit, and the goal is to just keep your child safe, look at it at that way and just stop there. Do not go beyond that. And you still want your child to enjoy, look for alternatives. Toys, okay, fine. You're not able to buy soft toys. It is fine. You can make dolls with non-toxic doves, play doves, or you have artas, and you can do so many things. You can add colors into it, and make whatever you want, play with the child whenever the child prefers. And there are so many things that you can make your life more creative and exciting, and also guilt free to an extent, because mother's mind is never contented. She always wants to give more, but she's also worried at the back what to do if this happens. Okay, so
Yes.
that if factor, if it is removed, can always be a very happy one.
Yes, ma'am. Thank you, ma'am. And for the last question for the day, is like I said before, the symptoms of anxiety and the symptoms of OCD that develop due to being exposed to her child having febrile seizures, they tend to seep into other behaviors in other situations in the mother's life. So how can she prevent that from happening? For example, she has picked up some sort of compulsive behavior to often clean the house or something like that, and then she shows it in her workplace where she's compulsive. Her compulsivity is being shown. How can she stop herself from doing that?
Okay, can I just ask you, when she shows compulsivity at work, what does she do?
So there's this constant. Well, there is a combination of being obsessive and this compulsion, both at hands. So say she's constantly preoccupied with something and she has to be on time. She has to like fold the pages and keep it neatly, keep that neatly in a particular structure and stuff like that. Like if there's any sort of mess on her desk, she has to clean it. The desk should be in that particular place in the classroom. So stuff like that. Nothing more serious, but it is often some sort of beginning is what she feels.
Okay, so see, probably you can call it a precautionary behavior. I wouldn't know why you want to call it an OCD, because I think most of us do carry this, because there are certain people who cannot, for example, even me, I cannot work if the place is cluttered. So I tend to organize my desk first and then only start working. Okay, and if I see certain things out of place, I just wait until things are done and then I put it back in place. It
Yes.
just helps I'll give you your, yeah, it just helps our thinking process to open up when it is organized.
Yes, yes.
You wanted to say something.
Yes, ma'am. The thing about her in this particular case is she kept telling me that she was a carefree person before, and she saw a change in her behavior after she was exposed to this. So decluttering your desk
So,
is minor thing. Sorry.
but if you have been careful, which is good, I would say, because if you've been carefree, I don't know how responsible you would have been. So if something is getting into your head, it means you're trying to reorganize those events in your life and look into priorities. So I would say that, looking at it with a more positive aspect would help her frame her work in a nicer way and go on with life in a happier way than calling yourself with an OCD. If I mean, this obsession is something which, if it goes beyond a point where you're not able to control, when it is looking very queer, okay, probably very small little disturbances do happen. It happens to all of us. And like, when I think we should allow those little things as long as they don't interrupt in a very big way. Okay, suppose the person still finds it very difficult to cope with it, they can always talk to a therapist. A cognitive therapist can actually help with rationalizing, and once they go in for such kind of therapies, they open up to their problems, and they are able to view their problems in a much more rationalized way. So it helps them get over their issues. Failing which, even if a cognitive therapist is not giving much effect, then maybe they may need some bit of anxiety medications, which will help them come back to a level of stability where they will be able to think rationally. So with this case, I don't think that the mother has lost her rationalization, because she's only framing herself, and the situation is rather too sensitive on her, as from on her, that she is probably feeling overwhelmed with what's happening to the child. Okay, and at this point in time, it is equally important to take environmental support. People who are with the mother, or who know that the child is going through this, probably the extended family can come forward to extend their support and hand, and relieve the mother of certain household chores, and help the mother be with the child, so that she can feel more more at peace when sitting and watching her child, like, she's safe. So once that affirmation comes to the mother that my child is safe, you never know that even this OCD, what she claims, might gradually vanish. It's just that she feels insecure about her, even the smallest absence from the child might cause something to the child.
Yes.
So, anxieties can take your mind, or it can build big castles. So, taking support or asking for support is equally important, because everything cannot be handled by an individual, when you are struggling. Okay, so one thing I would like to say is, if you feel you are in pain, never hesitate to ask for help, because there are people, trained professionals, who will come forward to definitely extend that help. And also, your extended families, you need to explain your situation to them and tell them that this is what you're going through, and their support may equally contribute to the solace of the mother. So, a lot of things contribute to mental peace. I think it's good if we talk to someone who can help us get out of these issues, rather than hold it to ourselves and think that we are coping while we may be sinking.
Yes.
So it's always better, stitch in time saves 9.
Yes, ma'am. Thank you very much for being here with us today, ma'am. And you have shared so many insightful opinions and your knowledge here. Thank you very much for being here with us today. Yes, ma'am.
Thank you,
Thank you.
Tarini, and